Thank you so much. Well, today's the day, Doc. 50 years ago, the first Tommy John surgery on Tommy John himself. Give us a feel. What was it like in the industry back then, and what kind of an impact did it have on this game?
Well, you have to remember, I was in 7th grade when that happened. So I didn't know what Tommy John was until probably the early 90s, and a lot of people didn't know. But I've gone on record, and I'll tell you that I think the two biggest advances in sports medicine to keep our athletes on the field over the last 50 to 75 years has been, number one, the ACL reconstruction, as we all see every week on the NFL and Major League Baseball, and the Tommy John. And the Tommy John procedure that was done by Dr. Jobe was pioneered in 1974 on left-handed pitcher Tommy John, and I think it's revolutionized what we do as far as taking athletes and keeping pitchers on the field. And as we found out, it's become an epidemic over the last couple of years.
Yeah, the research that I did said it was expected about a 1% chance that he would be able to pitch again. Give us a feel for those first few years after that successful first surgery. How many major leaguers had that done versus what it is like today?
Well, first of all, when he injured his elbow, there was no cure back then. I mean, we've had pitchers, Sandy Koufax, you go back and find out the guys that have left the game because of their elbow. And so Frank Jobe was a polio specialist out of the Sentinella Hospital in Los Angeles, and I got to know him as one of the great prides of my career is getting to know Frank Jobe and what a great man he was. He's in a Baseball Hall of Fame, and he should be. But they did Tommy John surgery, and Tommy John I've gotten to know also. He had a subsequent second surgery to move his nerve, and then he was able to come back and win more games after the surgery than before. But the scary part is, think about this. Think about if that procedure didn't work in 1974. Where would we be? Where would we be going now with reconstruction? So over the first 10 years after this was done, only 12 players had it done. And then in the early 90s, it started booming when we started getting more and more success. And now, 36% or more of Major League Baseball pitchers have had Tommy John surgery.
In today's world, what's the timeline like from when a surgery is done until the player is back, and what is that ramp up like to get back onto the field?
You know, it's interesting. When I first met Tommy John about 10 years ago and had a great conversation with him, the rehab that he did in 1974 is pretty similar to the rehab we do now, which is pretty scary too, because the technique that we've done surgically has improved tremendously. It's about 4 to 6 months before we let the throwers throw. We build them up into a mound program, and it's about a year before they're hitting stride. As you recall, we have a couple players with the Reds that had it done last year, Overton and San Martin in the early summer, and they're both pitching in AAA now, and assuming and seeing what happens of whether or not they get a call up. But so it's about a year.
You are part of a rather historic effort with very limited precedence of Tejay Antone trying to come back.
Yeah, we know the longevity of Tommy John surgery. The average is about 6.5, maybe 7 years. We're starting to now do revisions on the kids that actually have their ligaments torn. But TJ was a unique case in the fact that he tore his twice and had a third reconstruction. So we don't know how that works. TJ's done a lot of work to try to get this information out to people so they can see what the journey's all about, and I give kudos to him. He asked me if I would help, and I was certainly anxious to help get that word out as far as what you do when you have the surgery, how you go through it, maybe ways to prevent it. But unfortunately, I think that's going to be more the norm over the next 10 or 15 years of guys that have had 1 or 2 or 3 Tommy John surgeries and try to come back and play because, again, the lure to the big leagues is so tempting.
So when a Tommy John is done, I read about how some are trying electively to have this done, that there can be positive benefit from it. What's your point of view on that mentality, and what does it do to the ligament and to the throwing mechanic?
Well, what you're basically doing is taking a ligament on the inside of the elbow that tears, and you're taking a graft or a tendon and transplanting it there. Much like we do with the anterior cruciate ligament. The ligament tears, you put a tendon in, and over a period of time, that tendon you put turns into a ligament. Now we found fancier ways where we repair the ligament with the internal brace, and people that have had revisions or hard throwers or tissue loss, and Justin Wilson is one of these that have had what we call a hybrid, so they have both the ligament graft and the internal brace, and we found that that's worked quite well. So again, we're evolving in this procedure technically, but the rehab, quite honestly, is still about the same.
Where do you see this going in the future?
Unfortunately, I see the numbers skyrocketing. I see the biggest problem we have with pitchers is they throw too hard. They throw too hard and too much. And we rely too much on evaluating our pitchers by velocity. And if you don't hit 90 miles an hour in high school or college, most teams don't want to look at you. The days of being able to pitch, to hit the corners, to have late movement, the Greg Maddux type, the Tom Browning type, change speeds, you got to learn how to pitch. So as long as we're going to be enamored by speed and guys that throw 100 miles an hour, the body's not made for that. They won't last long. So we have got to really change our direction in not only Major League Baseball, but our minor leaguers, our high school kids, college kids, summer leagues, and understand and learn how to pitch correctly. Learn and understand, like Chris Welch will tell you, learn how to pitch, learn how to use your mechanics, learn how to throw strikes, learn how to deceive these hitters, because the hard-throwing guys, if you're throwing 90-some miles an hour coming out of high school, it's only a matter of time before you have Tommy John. And then early in your career at professional baseball, if you have to have a revision and or another one, we don't know what those results will look like. So the key is being able to prevent it. And hard throwing, I think, no question, the slickness of the ball has really hurt. And TJ will tell you this too. Sonny Gray will tell you this, that if you grab the ball, it's too slick, you got to grab it tighter. And by grabbing it tighter takes a lot of the muscular stress that protects the elbow away and makes the ligament more vulnerable to be injured. So, you know, we have to find ways at the major league level to prevent this so we can keep our star players on the field playing, the guys that we come to watch.
Well, thank goodness for folks like you and for the original procedure by Dr. Job and Tommy John 50 years ago today.